Florida Gators center Micah Handlogten suffered a serious left lower leg injury during the SEC championship game on this play. And in this video, we're going to take a look at how exactly something so unusual looking and severe can happen from seemingly a very benign mechanism. Plus, we'll talk about what we do on the court to manage an injury like this and how it will be ultimately treated. Welcome back, everybody. I'm Dr. Brian Sutterer, and the goal in the channel is to help teach you about the medical side of the sports world. We're going to look today at a pretty tough one here. This was Micah Handlogten in the SEC championship game, and what he appeared to suffer was at a minimum an open fracture of his left tibia, probably as well as the fibula, the two bones in the lower leg. When people watch this replay, it's a very bizarre thing to see. It reminds a lot of folks with what happened to Kevin Ware. Whenever somebody sustains a fracture of their tibia, there's two general ways we can categorize them. We can categorize them as either low energy or high energy. A high energy is what you typically think of as breaking your leg. It's a car accident. It's a fall off of a ladder, a fall out of a tree, a football player striking the front of their leg with another player's helmet. And then the other is a low energy. So what happened to Kevin Ware back in the NCAA tournament where he simply jumped, landed, and broke his tibia. And what happened here with Handlogten is an example of a low energy type of tibia fracture. And these low energy tibia fractures almost always occur when there's some component of torsion. So some component of twisting on the tibia. The tibia is not designed as well to handle torsional or rotational twisting forces. And so these low energy ones occur when there's a torsional force through the tibia, resulting in a specifically spiral fracture pattern because of that twisting force. So here with Handlogten, as he's coming around here to try and get this rebound, we're going to see how his body makes this rotational turn. And it's that rotational turn, that twist, as he goes to lands with all of his weight on that left leg. All that momentum is swinging around, twisting. That torsional stress goes down through the tibia and ultimately is going to cause that break. And there's no need to actually show it. So we're not going to show the actual bone breaking because I think anybody who wants to see that can go see it elsewhere. Another way that we'll classify these fractures is open versus closed. And that is all determined on whether or not the skin has been broken. And now the bone doesn't technically have to be poking out of the skin to be considered an open or a compound fracture is another term. But as long as there's any sort of breakage in the skin, we would classify that as open because that skin barrier has been disrupted. These have a much higher chance of infection because now when you've disrupted that protective skin barrier, there's a better chance for bacteria to get in and lead to a potential infection. That's what unfortunately we saw with Micah. We could see that there was some bleeding on the court after this injury, and so we have to assume that this was considered an open or a compound tibia leg fracture. Thankfully, though, it doesn't look like there's any severe gross malalignment. Whenever we're looking at his left leg here, things look to be pretty roughly in that normal reduced position, which leads into what we're going to do to manage this initially and then in follow-up. Now, initially, whenever the medical staff gets out here, if I'm covering an event and something like this happens, it's going to be pretty apparent right when you get out there that there's been an injury of this magnitude. The player is going to be pointing to their leg. You're going to be able to see most often either some malalignment, the malpositioning of the limb. You're going to be able to move it too easily. There's going to be severe pain, or in this case, you might see the bleeding. The first thing we're going to try to do, because we already know that we need to stabilize this and transport them to the hospital as quickly and safely as you can. Specifically, when you have an open fracture, the soonest you can get antibiotics on board, the better. One of the best prognostic factors for infection and long-term outcomes with these is how quickly you can get IV antibiotics started. And so their goal here is this clock is ticking. We want to safely get the athlete immobilized, protected, off the court, and to the hospital. And we can see right away they were able to get the emergency crew sort of mobilized off the side of the court. And so it wasn't any more than maybe 30 seconds a minute before we already saw the ambulance crew coming down here. So really great prompt response by the medical staff here of Florida and presumably maybe Vanderbilt, who might have been there because of this being in Nashville. Now, the next thing we're going to do is we want to grossly realign or grossly reduce the fracture, meaning if the bone or the leg is bent like this, you want to do the best you can to try and get it in a reduced position. That reduced position is going to limit the stress, the damage on the soft tissue like the muscle, the nerves, things like the blood vessels in the area, and can also help a little bit with pain. And so the best you can, if there is a lot of malalignment, you're going to try and manually reduce as best you can. Now, it's not going to be perfect every time. You know that's not the final definitive treatment. In the case where it's an open fracture, you know you're going to do surgery. If it's a closed fracture, You might not have to do surgery, meaning if the skin's not been disrupted, there are some tibia fractures where you actually don't need to do surgery for them. And so your proper reduction and alignment, especially early on, can play a big role. But in this case, you know it's going to need a surgery. All you're trying to do is your best to get it safely immobilized for the purpose of transport to, again, get to the hospital as quickly as possible. We heard them talk about something called an air cast. An air cast is a great way to immobilize. They're very convenient to carry around in a medical bag. Essentially what you do with an air cast is you put the air cast in a sort of soft, flimsy position over the limb, and then you actually suck the air out of it. And as you suck the air out of it, it sort of vacuum seals down and becomes rigid to protect and stabilize that broken leg for the purpose of transport. Surgery for this then is eventually in part a rod, an intramedullary rod. The intramedullary canal is the inner part of the long bones, and so a rod will be placed down through that intramedullary canal, anchored at the top and the bottom. There's, like I said, often a fibula fracture, so this bone on the outside here is the fibula. This large one is the tibia. Sometimes they have to put a plate or do something with the fibula. Oftentimes it can just be managed with an intramedullary rod or a nail inside the tibia, typically made of titanium. With our biodigital anatomy tool here, if we just take a quick look at these bones, of course, the tibia, that's going to be the shin bone, the fibula, the smaller, essentially non-weight bearing bone on the outside of the leg. I talked about earlier, the bone is not very strong with twisting. So the tibia is really strong with direct compression. So forces that are going to be coming in from the top, pushing down this way, the ground reaction force pushing up, and then also to some degree bending. But it's that twisting rotational force that the tibia is not as strong to withstand. Part of that is because of the shape of the tibia. So the tibia has this triangular appearance where if we look from the top down at a cross section, it almost looks like a triangle. That triangle is going to be really strong in compression, but not quite as strong in that rotational torsional stress. And so when we see these types of injuries, these types of fractures, again, think about that torsional rotational twist as a likely mechanism for these lower energy types of breaks. Long term here, assuming there's no infection complications, assuming there's no damage or severe trauma to the soft tissues like the muscles, the nerves that require any intervention, if this is just the tibia, this should not be a career-ending long-term type of injury. We've seen Kevin Ware come back and continue to play basketball at a pretty high level. So yes, the just mental trauma of what you went through can often be the hardest part to overcome. Putting a rod down the tibia is really not that challenging, all things considered, in the world of orthopedics. And so it's those other possible complications, infection risk, compartment syndrome, damage to the soft tissues. Once you don't have to be as concerned about those, then this is not something that should be a career-ending or really significantly life-threatening type of an injury. My best goes out to Micah. Again, great job to the Florida team for really promptly recognizing, getting him transported off to the hospital. Let me know as always any questions or comments down below, and I hope you learned something, and I'll see you in the next one.